The most common disease people are dying from is like coronary artery disease. And I'm trying to help the most people as possible. So let's say if that's like the number one killer and they want to see you and they want to just get educated and not freak out. How does your practice look if you're helping somebody with that type of ailment?
Well, yeah, we'd always have to see, what are the symptoms? How does it show up for you? The coronary arteries are controlled from the cerebral cortex, and the conflict is a territorial loss conflict. And so we have to look at, when did you lose your territory? What do you consider your territory? It's different for men and women because men, right-handed men, when they have a territorial loss conflict, this has to do, with their their work, their job. Like a lot of men, if a man dies of a coronary heart attack, it's actually the heart attack comes after the conflict's been resolved. So this is a very interesting situation where, let's say that your whole career you've been in this territorial fight for your position in your company, and so you're always in this territory conflict. And then you retire and you're like, well, I don't ever have to worry about this again. I've resolved this conflict. But if you've been in that conflict for, 30 years, there's a time limit for every biological program. And there are certain programs after a certain period of time, you actually don't want to resolve it. Dr. Hummer says you should stay, if you retire from your work, you should stay on as the night watchman so that you can keep, some territory conflict going. So that is what causes adaptations is a territorial conflict for men or a sexual conflict for women, which affects the coronary veins, which leads to a pulmonary embolism during the healing phase. And so those are two of the more kind of complex areas to understand as far as resolution goes. And so it's territory loss and how you perceive your territory. And often this happens very early for boys. They will lose their territory because they've got an older brother or they're being bullied at school. And so, there's a lot to that one.
If you believe more constructive information like this should be out there for people to know, please leave a like on this video. And if you're a person who's into self-development in all aspects of their life, please subscribe because that is what we do here at Good Demand. Keep demanding good things. And if you haven't bought a pair of our Good Night Blue Blockers and you use a phone at night or an iPad or TV at night, please consider buying a pair of these. They're beautiful and they work so well and they help support our growth.